Hello, welcome to the GLP-1 Hub podcast. My name is Anna Reisdorf. I'm a registered dietitian and GLP-1 user. So today on the podcast, we are going to have Dr. Rosenbaum talk all about weight loss, side effects, and a product that he is involved with that I was actually really impressed with. They actually did not sponsor this episode, but their research is so good that I just gave them a spot anyway. Anyway, you may notice we have a new store on the website. So if you go to glp-1hub.com, there is a store on there where you can find meal plans and a get started guide that was created by myself and one of my dietitian colleagues, and a bunch of recipe collections. So you can grab those on there. You're also going to want to be sure you're following over on YouTube. The YouTube channel is exploding. I am sharing a ton of personal stories on there. There is a video that I did a couple weeks ago about how I have tried personally to get off the medication twice. That's right, twice, and failed twice, and what I might do differently if I ever decide to get off again. So you're going to want to watch that video and leave a kind comment, because taking a lot of heat for it. So kind comments are always welcome. And if you are enjoying this podcast, please consider leaving a review. A written review is always most welcome on the Apple Podcasts or Spotify or wherever you leave your comments. So all right, let's get on to the show. I want to welcome Dr. Rosenbaum today to the GLP-1 Hub podcast. So thank you so much for being here. Tell the people about your work and what you do and who you are.
Thanks so much for having me. This is really neat. And I love the subject of GLP-1s because they're amazing medicines that have really transformed an area that I've been working in a long time. I've been doing functional medicine and nutritional medicine along with sports medicine and exercise. And, these medicines, they really work, and they take away a lot of that sort of blame for people being heavy. If you can take an injection and you end up losing weight, it's not really your fault as much. So they're not perfect. Most people don't stay on them forever. There are some side effects. You have to be very careful with your nutrition. That's why I'm glad I'm talking to you, because when your appetite goes down, you're not going to eat as many calories. So you better make sure those calories are good. Mm-hmm. Otherwise, my classic thing with the GLPs is, I have a guy who wanted to lose weight. He was like 50 pounds overweight and When I get a dietary history and he ate 6 pieces of toast for breakfast with butter and went on GLPs and lost 40 pounds. And now he has 2 pieces of toast with butter, so he's probably not even getting enough riboflavin now. And then there's also the muscle loss. That's true of any weight loss, but it's especially noticeable with the GLPs because in some ways it's so easy. People aren't necessarily exercising or supplementing their protein and micronutrients the way they need to.
Right. So have you been working with GLPs before they were popular for weight loss, like when they were for diabetes, or
I didn't do as much diabetes care. So really, I started to prescribe them more for weight loss. When I get a diabetic, I would give them as well. But, mine was more weight loss. I mean, I've been using metformin, some of the other diabetes for weight loss, but they just don't compare. As good as glucophage or metformin is, you lose 5 pounds, 40.
Right. And so is everyone coming in now to see you? Do they want this, or how are you?
Yeah, people come in and ask for it. Yeah, and as a lot of it is telling some people this really isn't for you. This is not a lose 10 pounds kind of thing because you want to fit into your dress for a vacation. There's doctors who will prescribe that, but I'm not treating even movie stars like that. I say, look, you can lose 10 pounds on your own. So
right.
Because there are the side effects. The nausea, the vomiting, diarrhea is not uncommon, and for 10 pounds, why do it? It's nice that there was a question of risk to the pancreas, and that's sort of been shown not to be true. So there's not a really big problem. I wouldn't give it to people who had histories of pancreatic cancers in their family, and now I do because there's really no. I think that was just a misfinding.
And then what I've heard is really the main thing is the thyroid cancer risk, because that rare thyroid cancer that it might increase.
Yeah, and that's not even a definite one too. I mean, you still still got to take care of patients and make sure they don't get anything.
Sure.
But I'm not so worried about it now.
And so what do you do when somebody does come in and wants to use it for 10 pounds?
Yeah, I advise them to try different things, and I'll put them on a shake, have them do exercise, do all the things they can do. 10 pounds is very doable. You're not gonna. It's very hard to lose 30 or 40 pounds, but you should really be somewhat significantly overweight,
Right.
with enough visceral fat that you want to really get that visceral fat, because you get rid of that inflammatory fat, you're really going to improve people's health parameters. But if they're near normal weight, they're probably not that inflamed anyway. So.
Mm-hmm. Right. And so what are you seeing in addition to the weight loss? You mentioned inflammation and blood sugar. Like, what are some of the other beneficial effects that you've been seeing?
Well, I mean, it's also been proved in studies that it stops cuts down cardiovascular risks, stroke risks, even chronic kidney disease. And hypertension, you lose that weight. So really a lot of upside to it.
Right.
Like I said, you have to people want to increase their dose really quickly. And I said, look, you don't want to get the side effects. You don't want to get as, so nauseous. So we got to go sort of low and slow. That's because it's a hormone, and we've got to be careful with it. I am finding too, but it depends on insurance and this and that Ozempic seems to have, for whatever reason, has more side effects than Mounjaro. So
yeah. And so are you using the prescription kind or the compound type?
Well, both, but the compounding has basically gone away now because the shortages are over. So all those fly-by-night companies that were hawking the weight loss, sort of, they're going to have to fold up their tents,
They're still coming at me in my DMs.
Oh, my God, the number of people want me to work for them. I'm like, you're going out of business in a couple months. You're like, dude,
Somebody told me the other day, we're a gray hat company. And I'm like,
what does
that mean? You operate in the gray area of the law? I was like, block?
Half evil, half good. That's awesome.
I was like, I don't think I don't think it's a good fit.
Things you shouldn't say out loud when you're trying to get a legitimate person to work for you.
Right? So anyway, you work with a company called Ozempic.
Yes.
Okay, so tell me a little bit about that work there, because that product is very interesting to me. I've been working in the supplement industry as a writer for the last 10 years.
Yeah. And
that is a unique company.
It's really neat. I get approached by different companies to pitch for them and this and that. And if they don't have something different, it's really not worth doing. But Ozempic, I really looked at the product because, I had a little bit of an idea that it's sort of the Slim Fast of Europe, but it's a much better product. It has a real density of nutrition. The formulation that they use probiotics and the way they sort of cook it up, extra kind of bioactive peptides, and tastes good. It's easy to use, and people get really good benefits on it. And the big difference is they do actual studies with their product, not just people who eat a protein thing or they have a little extra, these nutrients do better because of this one crummy study. They take their product and give it to people with diabetes and show that it really helps with diabetes and that it helps with weight loss. And head to head with other products, it just actually does what it says. So, I can't really be a spokesperson for a product that I don't think is valid, but it's really valid, and it's fun.
Right. As someone who's worked with the supplement industry and written some of the claims personally, and I see that sometimes it's around research from something else or from rats or from whatever. And that was really impressive to me that it was actually research on the product. Oh, yeah.
Now, these Germans don't mess around. They get the scientists and they go and do it. And the family that runs it, they're this great family. They're really neat. But they really care about the product too. So, yeah.
So you mentioned something that you said, the bioactive peptides.
Yeah.
So to explain to me kind of what that is exactly and why you think that's beneficial in the product.
They generate a whole bunch of different ones in the way it's sort of grown. It's not really processed, and some of these things actually help with weight loss. They actually, in some ways, there's a suggestion that they mimic what the GLP-1s actually do. It has a lot of good soy protein, but along with these bioactive peptides, they show that people would lose weight and not lose muscle. So something's going on, which is really impressive, because anytime you lose a lot of weight, you're going to lose some muscle. That's just part of it, what it what happens, and you kind of expect it. You just want to have to lose more fat than muscle. And it's not the end of the world, because if you're losing a bunch of fat, maybe you don't need as much muscle to carry your body around anymore. But they had a really good study that showed that people lost weight and just fat and not muscle, that it was actually muscle sparing. And they even had a study where people put on muscle when they use this. And soy protein is good, but these other bioactive peptides, I think, is what really pushes it over the edge. And they can't study every single chemical in there and figure every single thing out. But for whatever reason, this product keeps muscle on you. And if you I don't have to tell you, a dietitian, if you can lose fat and hold that muscle, you're gonna lose weight, and you're gonna be able to keep it off, because you still have the muscle, the burning machine. So
right,
and that's what
at a calorie deficit, like they lost weight at a calorie deficit and still kept
they
the muscle.
really didn't put people on
know?
restrictive things. They mainly just had them. Almost all their studies, they don't put they give them a little counseling and this and that, but to both arms of the study. But it's not calorie limiting. They just add the shake, and usually they add the shake so you take out one meal. Maybe that's calorie sparing, but they don't say you can only have this many calories and blah blah blah. That's the impressive thing, because people will eat around things, and so it's nice to know that all you gotta do is use the product and you're going to get some results that way. And I like this one too, when people, like, if they hit their goals, like I like to use Almacet with it, because I think you get the synergistic effect and you can lose weight really fast. And I'm finding, just anecdotally, they haven't done the study yet, but when you take Almacet with a GLP-1, that you maintain your muscle mass. So I think they're working on doing that study, which I think is going to show that, because they're losing a little bit of muscle, but not the same amount. So, and then when they want to come off, or you want to go to a lower dose, if you just add one shake a day, it's easier to do that. So, and like we were talking about before, that lose 10 pounds people, I say, try this Almacet. It's really good. They use it in Europe. People like European stuff. It seems fancier. So, and it's really easy. And I like Almacet because I'm a big believer in like a big green shake in the morning. Okay. So I use Almacet as the base, but then you throw some kale, or you throw in some frozen berries, and you throw in all your different supplements, and like you get a good enough blender. I always have them put because most of my patients I put on 10 or 11 different vitamins depending on what they're doing. And you just blend it all up, except for the really nasty tasting ones. And if you drink that down, boom, you're sort of covered for the day.
Right. So when they sent me a bunch of it, and I wasn't sure about it before I looked at the research, and I was like, they sent me like six cans of it, and I was like, I'll just give it to somebody.
You got a box, huh? Yeah.
And I was like, I'll try it and then give it to somebody. So, but then I started looking into it, and I was like, wow, the only thing that I was a little bit like concerned about, which I ended up doing more research into, was the sugar content, because it does have raw honey.
Yeah, but not a ton, but yeah.
Right. So that was like, well, most things for like people with diabetes have like fake sugar.
Right.
Do you have any idea of why they chose to use the raw honey instead of like these fake sugars?
Oh, they're sort of like the patriarch grandpa came up with it, I don't know, like 100 years ago, and I think he used raw honey instead. But honey is very interesting because, honey, it's immune modulating. Honey itself tends not to raise blood sugar as much, especially raw honey. And when you take it in with enough protein, and when I have people make a shake, I always have them put some fat in too. You can't really have fat in a shake because it gets rancid, but you should have some good fats in there, and that keeps you from getting a sugar spike. I mean,
So what's your recipe? You mentioned kale.
I use it. Yeah, berries. I like to rotate. I tell them to like get a bunch of frozen veggies because it's the easiest, and like rotate a green. So kale, spinach, broccoli, even, and then some berries. So and use blueberries, raspberries, strawberries. Rotate them around. Then I'll have them put in some olive oil, usually some alpha-linoleic acid for more fat. I like something called phosphatidylcholine, which is a supplement which is really good for skin and brain, and then usually a multivitamin, and I add a bit more probiotic, even though there's some probiotic in the Almacet. As long as you use frozen vegetables, it comes out as a nice sort of creamy shake.
That's a lot. That's a nutrient dense shake.
Oh yeah, no, if you have that for breakfast, you barely want lunch till 1, easily. Yeah.
Right, for sure.
Yeah.
And so they have a lot of studies on liver health.
Yeah.
And so people, when they are obese, they have like this fatty liver where their liver gets fat deposits. So what did they find there? What does the shake help with that fatty liver?
Well, it's regulating the blood sugar, and it's really the blood sugar that sort of tips you into a fatty liver. Excess sugar in the liver is turned into glycogen, and then it can also turn it into fats, and and then fat becomes inflammatory, and it becomes a cycle like that. And it's been shown to reduce the fat deposits on the liver, because fatty liver is, it's a bad condition. Diabetics get it, and it's hard to treat. It can lead to bad things. Yeah.
Now, has the GLP-1, have you seen improvements in fatty liver with the
Oh,
use
yeah.
of the GLP-1?
For sure. Yeah, definitely.
One of my neighbors got on the GLP-1 for that reason. Her liver enzymes were elevated, and they're normal.
Okay. And she was diabetic too,
I don't
probably
think so, but
it's interesting. It's possible.
I don't know.
Yeah,
I don't know all the medical history. Just neighbors.
Yeah.
It's like casual conversation.
Yeah.
Well, that's great. So with a person who's on a GLP-1, like just one shake a day, you think would be enough to promote the weight loss?
Two is too many. I mean, I think you can replace one. Some people add it in, and I think that if they really don't want to skip a meal, but I encourage them to take one meal. Breakfast is usually the easiest, and that's because you're in your own kitchen and you can have all those other things to throw in there.
Sure.
And you just replace one a day. I sometimes say, like, look, it's not a bad snack if you just want to have one little scoop towards the end of the day and you're getting hungry. But the thing is, people don't really need it. I think because on the GLP, they're not hungry. So in some ways, like, that's why I like it in the morning, because that's the closest you're going to be to hungry all day, because the emptying time is really slow from your stomach. So that's when you want to get a good meal in, and you want to get a lot of nutrition. You want to get a lot of protein in then, because if you don't do it then, you can't catch up. So
no, definitely not.
Because you're not. Just people like it. They're not hungry. They don't think about food. It's they're pretty crazy medications actually, because they're good for like quitting alcohol and drugs, and it's amazing what these things do. They seem to have an antidepressant effect, and there's a suggestion that they cut down on the progression of Alzheimer's, because what they're doing is they must do all those things. When something cures everything, it's almost always anti-inflammatory. And it's anti-inflammatory in the brain. There's GLP receptors in the brain. There's lots of them there. So it's not surprising to see that, but it's a real new age of medicine.
The addiction thing, the alcohol and the smoking and all that.
Yeah.
Is there a connection between inflammation? I mean, obviously alcohol is inflammatory.
Yeah.
But like your desire for alcohol is not due to inflammation.
I don't think it's inflammatory in that sense. I think it actually is more has to do with satiety, because one of the things the GLPs do is decrease the desire to eat, the hunger response. And that same response, it's dopamine pathways. It's the same for drugs. So that's where it's got to be. Yeah.
Right.
So, I did back in my days in medical school. I almost got an MD, PhD studying drugs of abuse in rats and stuff. And, there's all these different circuitries and dopamine circuits. And the brain is just built to be a drug addict. It's terrible.
It's terrible.
It's terrible.
Or sugar.
And this is a drug that works to block that, because back when I was studying, the only things that could really block it were things like naloxone, which is what they give you when you're having an overdose. But they're dysphoric in the sense that you don't feel good when you have them. No one wants to take naloxone. They're using it now, something low dose naloxone, which actually does like a reverse effect of it. But like all the drugs before the GLP-1s, no one would take them. No one's going to take Antabuse to make you stop drinking, because the way it works is make you vomit. And what you do is just don't take it, so you can drink more. But this is, a medicine that, you lose weight and you drink less, and it's these things kind of sell themselves.
Right. So on the Zepbound Manjaro sales page,
yes,
there is a warning about suicide.
Yeah.
What do you like?
I don't know. This is the same with Prozac and this and that. I think it's, because it's such a strong finding. If someone kills themselves and they were taking it, they have to put it in. Do I really think that that's part of it? No. I mean, I worry about it with SSRIs. I think people sometimes kill themselves early on because when they're so depressed they can't do anything, and they get just enough energy to be able to kill themselves. That's my sense. That's what psychiatrists will say. But with these, it's great to have the warning, but I don't worry about it. I don't even mention it.
Right. Well, I think that I have a theory, which is I used to work with people who lost a lot of weight, and they thought their weight was the cause of their other issues.
Yeah.
So when their marriage didn't improve, when their life didn't improve, and they were suddenly thin, that was like really devastating to them.
Yeah, I've heard
They're like,
that.
my husband is still a jerk, and I'm like, well, he was going to be a jerk anyway.
It's an abusive
Right.
jerk.
So, and that was hard.
Yeah. I worked at a nursing home, and they had a clinic, an inpatient clinic for morbidly obese, like super obese, 600 pounds, this and that. And it's very sad condition, and it's the rate of like sexual abuse was really high among people. That what they told me and what I learned is like people did it to protect themselves, so their fat almost protected them from that. And I guess if you lose that protection, you're naked again in a way, so
stuff comes up.
yeah. And I guess to be treated nice when you were treated so bad before, it's to transform into something better isn't easy. It's not easy.
No, definitely not. So do you think that the GLP-1 could work for somebody that is 600 pounds? Because I'm seeing people lose like 100. I have a gal coming on that's had lost like 200 or something, but
they should definitely do it. Yeah.
Yeah.
Percent.
They don't need like a gastric bypass before and then do
No,
this.
well, I mean, this does some of the things that the gastric bypass does, and it does it and it's definitely safer to do that than a gastric bypass. And a gastric bypass, if you weigh 500 pounds, it's a dangerous operation. I mean, they're tunneling through a lot, and if things go, people die from that operation, and it's irreversible. I don't know what the bypass guys, girls are doing now, but I would imagine they probably start them on GLPs first. It would be unethical, in my thinking, to do an operation before trying those medicines.
Right. And so you talked about maybe getting off of the medication after a period of time. So what are you seeing there? Are there people who want to transition off? Do they always need a little bit? Like where?
I get a lot of people who will cut back, because usually once they plateau, you can cut back and it still works. Like whether you're giving them, 12 and a half or 15 of Mounjaro, you can cut back to 5 and they still maintain that. And just, I mean, it's still pretty new medication, so a lot of the people I have it on are just still on it, but the studies show that people don't take it much more than a year anyway. So, like, what do you do then? And it may have a lot to do with, they lose their insurance or this or that and the other thing. So I think you really have to have a plan, because it's great to lose 40 pounds or even 20 pounds, but to gain it all back is really devastating. So if you have a plan where either you taper or go to a lower dose, or you have diet, exercise, you do something like Alma said, and then to maintain what you've lost is possible, but you got to have a plan. You can't just, stop sticking yourself and hoping things work out, because it doesn't.
Right.
You're a dietitian, you can't get anywhere without a plan.
Well,
hope doesn't beat the kitchen.
Hope is not a plan. Yes. Yeah. No, I mean, that happened to me. I took GLP-1, I lost 20 pounds, and I thought, I'm a dietitian, I can do this.
Right.
That was not the case.
Right, it's so hard. Well, it's funny. It's funny for self-admission. I got a sort of a mixed autoimmune type 2 diabetes. I was in the hospital 3 years ago, and I got really sick and almost died. And I was put on a GLP, and it works great. And I have a good endocrinologist, and like for me, I'm not gonna stop taking it. Unless my pancreas completely fails, but then because then you can't take it, then you have to switch over. But
sure,
she saved my pancreas, so yeah.
Yeah, and you're not in the hospital now. So
yeah, exactly. And it's really neat. What I do, and I use with patients a lot, is to have them get a glucose monitor, because you can really see what spikes up your sugar. The ones that you stick on your arm. So like I've done it with Alma said, you take it and it doesn't spike your sugar for whatever reason. And it's weird the things you can do. Like I can eat ice cream at the end of a meal and it won't change my sugar, but if I have like 2 spoons of rice, like it spikes up to over 200. Wow. So everybody has their own little quirks of whatever it is.
What's figuring
yeah, their enzymes and blah 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 blah. So,
right.
But I'm a big believer in the GLP-1s, and I'm taking one once a week as it is. So
yeah. So what do you think the future holds? Where are we going? There's a bunch of new ones on the horizon. There's other peptides coming.
I mean, just because of the billions that have been made and the pipeline is full of medicines, there's going to be oral medication, so people won't have to do all the injections. And there's some that are in the pipeline I've saw that actually are muscle sparing, so they're going to come out. And, 1 or 2 are probably going to kill people because they'll get it wrong.
So hopeful.
Exactly. But obesity is going to be something much more like high cholesterol. High cholesterol, we could treat everyone and they could have good cholesterol, but it'll be the same thing. Will people take it? Do they take it the right way? Did they take it for the long enough time? No. But, the medications are going to get better and simpler, and there's just too much research and too many good products coming down the line for that to be any different. And unfortunately, all the dietitians are going to be out of work.
No, we have to address their malnutrition.
I know. I'm
That's
teasing
what
you.
I'm
No,
doing
that's
now.
malnutrition. And malnutrition is it's a serious problem. Yeah, 100%. And people get, they're losing your muscle, you're losing weakness, and if you're missing those micronutrients, and people don't eat salads, they don't eat bulky foods. So like that's all often use like a super green or this and that, because if you're not getting those in, you just don't feel good.
Right. We need to brush up on like our scurvy and
Yeah.
like all of our old
100%.
stuff that we don't see anymore.
Exactly.
I should get that textbook out and look at all those malnutrition conditions.
Did you see these studies on citrus was found to be one fruit that actually helped the gut better than any other fruit or vegetable? It's like really neat. Like so now I do, instead of an apple a day, I'm like a tangerine a day. Yeah.
Good. Yeah.
Yeah.
I mean, preventing the scurvy from the
Yeah.
GLP-1.
Exactly. Going on my next sailing trip.
Anyway, thank you so much, Dr. Rosenbaum,
Thank you.
for being here. This was a great conversation. And
Yeah,
I appreciate
great.
all your insight.
Okay. Well,
Awesome.
I have to dig in and listen to some of your podcasts.
Perfect. Thank you so much.
Thanks, Anna.
Thank you so much for listening to this week's GLP-1 Hub podcast. Make sure you're connected with us on Instagram at GLP-1 Hub, on YouTube at GLP-1-Hub. Also, visit our website for the store to check out all of the resources that I have created just for you. And I look forward to seeing you next week.